They are never going to find this guy. He vanished the second he went into Central Park. Even
Do you know how much hate you gotta have in your heart to off somebody at 7 o'clock in the morning?
Yo, Brian Thompson fatally shot me. No, let me fix that for you. Greedy man who siphoned $10 million a year from sick and poor people.
Under investigation by the Department of Justice for alleged insider trading, he sold about $15 million in stock before a federal antitrust investigation into the company. So basically, before bad news, he sold a bunch of shares that caused the stock to drop. This company also had a very controversial use of AI. The company relied on a tool called NH Predict, which had a shocking 90% error rate. This AI allegedly overruled doctors' decisions and denied essential care to elderly patients, forcing some out of rehab early and others to miss treatments altogether. Why would they do this? Well, basically a lawsuit claims it was all about saving money, betting most patients wouldn't fight against the denials. And if that wasn't enough, United Healthcare faced massive ransomware attack, exposing the private data of millions of Americans. They reportedly paid $22 million to resolve this.
they are never going to find this guy. He vanished the second he went into Central Park. Even the NYPD, like an hour after the shooting, was glazing up this suspect, saying he's the best we've ever seen. He's a professional. They're saying he flew in from Atlanta. He had a burner phone. He ditched all of his gear. He took the time to etch, deny, defend, depose into all of the bullets that he used. I think that this guy is going to be this generation's DB Cooper. Like, they are just never going to find him. He's going to turn into an urban legend. He knew exactly what he was doing and he disappeared immediately. And the best part about all this is that he drastically amplified class solidarity, because no matter if you voted for Trump or Kamala, a lot of people are agreeing that insurance agencies are some of the most predatory companies out there. You pay into them for your entire adult life, and then they deny 32% of claims that could have been for life-saving care that probably resulted in the suspect's, loved ones or family members passing away unnecessarily. And I really do think that a lot of people are starting to wake up and realize that a for-profit privatized healthcare system is not in the best interests of the people that it pretends to serve.
By the assassination of Brian Thompson yesterday, who is the CEO of United Healthcare. Unfortunately, this is not the first time that United Healthcare has been connected with some serious atrocities. One of the biggest stories of healthcare this year about United Healthcare has not been told, and I want to share that with you today. So please listen to the end and please share this video. In February of 2024, Change Healthcare, which is the clearinghouse United Healthcare, was cyber attacked, which means it impacted payments to healthcare organizations like small physicians' office and even hospitals. So I want to break down what this really means with an example. Imagine you own a small spa and you accept gift cards, right? And it turns out that 50% of the people that attend your spa use this gift card to get their services. And you've promised to take these cards, you have a contract, you have to recognize these gift cards. So you have half of your clients coming in, they're using the card, and suddenly the card doesn't swipe or it's not giving you money, and you're trying to figure out what's going on. So you call the gift card company and they tell you, you know what, we've had a cyber attack and I'm sorry, we're not able to issue payment to you. They can't give payment. So now you're doing all this work, doing all these massages and all these services, and the gift card program is not working. What makes this extra atrocious is there is money on these cards. The gift card company is still accepting payment for these cards, but they're not paying you. This is exactly what happened with United Healthcare earlier this year. People were still paying their insurance premiums, but those premiums were not getting to the practices in the hospitals that were delivering the care. So small doctors' offices, especially offices with less than 10 doctors, weren't getting paid for months. There are some hospitals that were losing $20 to $100 million per day because of this attack. This is a huge threat to the U.S. healthcare system, and it's the reason why we don't want monopolies, because one company having all that power impacted care for so many patients. But wait, the fallout actually gets worse. For small practices that couldn't handle these cash flow issues, many of them struggled. Some of them even went under. United Healthcare did not do much to help these practices. And in fact, they offered to give these practices a loan for the money, and sometimes only in the amount of about $4,000. Many of these practices were doing hundreds of thousands of dollars a month with United Healthcare. So a $4,000 loan with interest was not a very palatable option. For the practices that were in most dire need, some of them actually did go under. And guess who came around to buy them? United Healthcare. To this day, I don't think there's really been any consequences for this massive fallout. There's been no congressional action. There's been no penalties. There's been nothing. So if you were accepting health insurance in this country, you were at risk of companies like United Healthcare not paying you money. Of course, I do not condone violence, but the death of Brian Thompson yesterday highlights what can happen and how serious things can get when we mess with people's lives and livelihood. So the impact on the U.S. healthcare system by United Healthcare was astronomical, and it makes me very frustrated that they've never been held accountable for what happened earlier this year, how many physicians, patients, and institutions it impacted.
United Healthcare CEO Brian Thompson fatally shot me. No, let me fix that for you. Greedy man who siphoned $10 million a year from sick and poor people, who was the CEO of the health insurance company that denied the most claims while simultaneously being number 4 on the Fortune 500 list, was clapped today in New York City. Out here looking for a single shit to give, to be quite frank with you. And before some of y'all come at me talking about, oh, you should care, this is wrong, blah, 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 blah. It is wrong. It's wrong when people die when they shouldn't have to. And until you, for a living, microdose human suffering and come face to face with people who are too poor to pay to live, and you watch unnecessary deaths for a living, don't come talk to me. Don't come talk to me. While he was wondering which yacht he's gonna buy this year and which, European vacation he's gonna take this month, there are people, my patients, who are being denied life-saving and necessary medications, procedures, and office visits with specialists. Rather unfortunate timing for the Blue Cross Blue Shield insurance company to now announce that they are going to pre-allot time for anesthesia for surgeries in 3 states, Connecticut, Missouri, and New York. And so if your surgery goes longer than their pre-allotted time, mind you, these are not surgeons who are pre-allotting the time. These are businessmen. If your surgery goes beyond the pre-allotted time, guess who has to pay for the rest of the anesthesia? You. And let's just say, 1, anesthesia is not cheap. 2, a surgeon is not a person you want rushing. So in lieu of flowers for old Brian Thompson, I'm gonna try to finish paying off the $1,000 balance that I have to United Healthcare for the necessary medical procedure that I had to go through in February of this year. Hope that helps. If you're gonna call me a bitch for this take, 1, you better work in healthcare. And if you don't, I will take no feedback. 2, know that I spend every single day of my career literally trying to alleviate human suffering and create some sense of equality in the healthcare system. I try to help with health literacy. I have more than once a week flipped my name tag around and said, I'm telling you this as a friend now. Fill in the blank, right? You need a second opinion, or this isn't correct, or you need to call this number and use this terminology when you are submitting your appeal. So.
If you were laughing about a man being murked on the sidewalk outside of his 5-star hotel, DM me. We have the same sense of humor.
Do you know how much hate you gotta have in your heart to off somebody at 7 o'clock in the morning? That was somebody's grandchild. I don't know this for a fact, but I believe it that somebody's granny passed because that insurance company denied her whatever medications or procedure that she needed, and somebody's grandchild avenged her passing. 7 o'clock in the morning. Thoughts, prayers.
I'm gonna be honest with y'all. Defend, deny, depose sounds a whole hell of a lot like liberté, égalité, fraternité, which was the battle cry for the French Revolution. Do not be surprised if we start seeing defend, deny, depose spray painted on buildings and yachts and bodies. We are long overdue. We are way past the wealth disparity of the French Revolution. We are way beyond that. We don't have aristocrats anymore. We have billionaires and CEOs. It's the same thing, and they cause just as much harm to the rest of us. I have a feeling that this is just the beginning.
They are never going to find.
If you're an electric bike, backpack, and firearm enthusiast who happen to be hanging outside a certain hotel in New York City this morning, and you're looking for a place to lay low, I got you. Send me a message. I'll come pick you up at the time and location most convenient for you, and you can crash here as long as you need. Drinks are obviously on me, but honestly, so is everything else. Food, clothing, whatever you need, your money is no good here. I got a PS5, a Switch, NFL Red Zone. Just take it easy. Treat yourself, my man. You've certainly earned it. I also happen to be well acquainted with countless like-minded individuals scattered all over the globe, and working together, we will underground railroad your ass to the continent, country, and city of your choice. This is a group of network providers that will not let you down because we know better than that, but also we appreciate your work. Godspeed, good sir.
This guy, he vanished the second he went into Central Park. Even the NYPD, like an hour after the shooting, was glazing up this suspect, saying he's the best we've ever seen. He's a professional. They're saying he flew in from Atlanta. He had a burner phone. He ditched all of his gear. He took the time to etch, deny, defend, depose into all of the bullets that he used. I think that this guy is going to be this generation's DB Cooper. Like, they are just never going to find him. He's going to turn into an urban legend. He knew exactly what he was doing, and he disappeared immediately. And the best part about all this is that he drastically amplified class solidarity, because no matter if you voted for Trump or Kamala, a lot of people are agreeing that insurance agencies are
Honest with y'all, defend, deny, depose sounds a whole hell of a lot like liberté, égalité, fraternité, which was the battle cry for the French Revolution. Do not be surprised if we start seeing defend, deny, depose spray painted on buildings and yachts and bodies. We are long overdue. We are way past the wealth disparity of the French Revolution. We are way beyond that. We don't have aristocrats anymore. We have billionaires and CEOs. It's the same thing, and they cause just as much harm to the rest of us. I have a feeling that this is just the beginning.
Deductible for maximizing your healthcare is like $4,000. Really? No. I think you'll be fine. Get the hell with it.
Only 10.
They'll never catch it. I don't think they'll ever catch it. First off, because no one is going to turn him in. No one. Even if people knew and they saw him and they're like, it looks like him, nobody's going to report him. That's one. But in the off chance, in the crazy possibility that they did catch him, because I think that dude knew what he was doing. But let's say that they did catch him. Who's going to convict him? Who's going to convict him? What 12 people, jury of his peers, especially in New York, what 12 people are going to sit down in a courtroom, in a fucking jury deliberation room, going to look at each other and be like, yeah, we should send him to prison forever. What 12 people are going to sit down and put that man inside a jail cell? You think you can get 12 New Yorkers who have probably been denied healthcare many times in the past by United Healthcare? You think 12 people?
10K? Y'all want to pay 10K for information about who might have did the hit on Brian Thompson? Y'all never finding that dude. Y'all see this map, bro? This man is an organized hit. This is why people are trying to say conspiracy that, oh, someone had to pay for a hit or something. Because look, he clapped them at 644. Bro went, hopped on a bike, took the back alleyway, did a whole little roundabout, walked his way to an electric bike, went all the way to the park where he knew there was no more cameras, got rid of his clothes, and then walked out that park and no one know where he went. Come on now, bro. This is a multi-millionaire CEO, bro. Or at least that company got millions. Y'all better up that fee to 100K. Man, you put the bounty for $1 million. I promise you find him tonight. I promise you. Them little New York YNs, bro. Them little street rats. Oh my God. They teaming up. All the gang beef in the end just to get that meal. That's when morals go out the door. That's when etiquette, man, what is etiquette? Find them. But for 10 bands, Nah, ain't nobody finding that dude, bro. Rest in peace to him, though. But yeah, 10K, yeah, y'all out of luck. 10K in New York.
So I got a question for you. If they catch this person who unalived the CEO of United Healthcare, if they catch this guy, how big do you think the GoFundMe is going to be for his legal defense? I mean, I'm just curious, because I know a lot of people, I bet, who throw $10 at this guy's legal defense. Not to mention, I think they're going to have a real hard time finding a jury that's, like, somewhat sympathetic to, you know, his situation. Because I think the American public is just fed up with all these rich pricks, especially in the healthcare industry, where they've been over the middle class and the working class since way before I was even born. But seriously, what do you guess the GoFundMe for his legal defense will be? I'm guessing $20 million at minimum. Minimum $20 million. But I could even go higher than that. Let me know in the comments how much money you think his GoFundMe legal defense will be.